And thanks for staying with us. Still on health matters, the Director General of the National Agency for the Control of AIDS, NACA, Gambo Sani Aliyu, has flagged off a capacity-building workshop organized for persons living with HIV/AIDS in Sokoto State. He said Nigeria is one of the 6 countries making a headway in the fight against the spread of HIV/AIDS, despite the shift of global attention to the fight against the coronavirus. We have details in this report.
Activities across the globe have been severely impacted by the outbreak of coronavirus. Healthcare personnel and other areas of healthcare delivery have suffered the most. A recent survey conducted by the United Nations indicated that there could be an additional 123,000 to 293,000 new HIV infections. The survey also revealed that there could be between 69,000 and 148,000 AIDS-related deaths by 2022 because of the effect of coronavirus on HIV responses. This was blamed on failure to invest sufficiently in comprehensive right-based and people-centered HIV responses due to the outbreak of coronavirus. But officials in Nigeria say the fight against HIV is making progress despite the global challenges of coronavirus. The Director General of the National Agency for the Control of AIDS says Nigeria is among the 6 countries of the world that have maintained a steady fight against the spread of HIV, and Nigeria is leading the pack, especially in identification and enrolling persons living with the virus for antiretroviral drugs.
And we are at the verge of controlling HIV to the extent that we stop AIDS and we achieve the goal we want to achieve in 9 years, within the next 3 years.
Sokoto State is one of the states in Nigeria with the lowest number of persons living with HIV, but the State Commissioner for Health says the government keep up its effort to identify persons living with the virus for enrollment.
I mentioned that there is need for people living with HIV/AIDS to participate or to enroll into the state contributory health scheme.
Beneficiaries of the training appreciate the agency for the initiative, saying it is a step toward achieving the goal of eradicating the spread of HIV by the year 2030.
They can continue to manage the disease in their body so that they can no longer pass the transmission of HIV to other uninfected persons.
A recent survey by the Nigerian government indicated national HIV prevalence in the country of 1.4% among adults aged 15 to 49, with an estimated figure of affected persons standing at 1.9 million. But a sustained effort by the government has reduced the rate of HIV prevalence in Nigeria, making the 2030 target of eradicating AIDS as a public health challenge feasible.
The Director General of the National Agency for the Control of AIDS, Dr. Gambo Aliyu, joins me live from Abuja for more on this. Good to have you join us, Dr. Gambo Aliyu. Nigeria, along with Nigeria, along with some other African countries like Kenya and South Africa, have been largely commended for how they have been able to control the HIV/AIDS within these countries. For us as a country, what factors would you attribute this success to?
Thank you. Let me emphasize that Nigeria is the most resilient among all countries that have HIV program in the world today to COVID-19 impact. And this is largely attributed by the fact that even before the COVID onset, we've already looked at the data we got from the survey we did that show us we have about 1.8 million living with HIV in Nigeria. But as at that time, we've only identified and linked to care between 760 to 800,000 people, leaving us with a balance of 1 million. So we come up with a strategy. The strategy is all these years, the last 15 years before the survey, we have been focusing on facilities and what we get from the facility. And what we get from facility every year, on average, is between 50,000 to 60,000 new cases to add on treatment. But from the time we started going to the community, you know, especially the communities we know that the HIV is raging, today we have added 400,000 individuals to treatment within the last 18 months. There is no country in the world that has achieved that feat in the whole history of 17-year history of HIV programming in the world. So this is a great achievement, and this is something that I attribute to the hard work of our grassroots individuals, the implementing partners, the development partners, our people at the facility and our people at the community,
All right.
the network of people living with HIV/AIDS. Yes.
So a lot of people will say prevention is always better than the control part of it. When it comes to the pre-exposure level of HIV/AIDS, that's where the focus should be. What are the measures being put in place to ensure that we control the numbers of those who are contracting the virus in the country, especially those who are at sustained risk, which means those who are living with people who already have the HIV virus?
One major component of prevention in the world today is treatment, treatment as prevention, and ensuring identifying people that live with the disease and making sure they take this medication and they keep virus within them, they don't give others, is one step that has helped reduce the number of new infections that we have noticed, and is one thing that has, over the years, been seen to reduce the prevalence of HIV, not only nationally, but globally. But that said, we also look at the drivers of HIV within our communities. There are some population we call key affected population. These are the individuals that either inject drugs and they share those needles with their colleagues, or they use sex as trade or business, the sex workers, or people that are living men that are having sex with men, or lesbians. These are groups, or transgender. These are all groups that are at higher risk of acquiring the virus and also giving it to others. We have focused our activities on this group. We're getting them, we're working with them in large numbers, and we're identifying people that have the virus within them.
All right, so I want to ask about awareness, because just people, a lot of people still don't think that, you know, right now people think that, look, what is HIV/AIDS? Do we see how people living with it? It looks like a disease or a virus that has gone away, especially now with the coronavirus. There's so much focus on coronavirus. What are you doing to keep people aware that, look, irrespective of coronavirus, there's still HIV and you have to be careful?
Yes, you see, for every good thing, there is also the negative aspect of it. So one of the negative aspects of keeping people on treatment and making sure that HIV doesn't show any longer on their face is this thing you are saying. People no longer see people with that emaciating illness, either in the hospital or on the street. They look and say, this guy has HIV, simply because those people that have HIV now are taking these medications, and this medication is giving them a look that is looking probably healthier than somebody that doesn't have HIV. When you look at them, they appear like fresh tomatoes. So this is the negative effect in terms of our awareness, but it's a good one in the sense that, you know, it is preventing people, it is preventing the virus, you know, from bringing people to the hospital and from killing them. At the same time, it is preventing the virus from leaving the people that have it to affect other people. That said, we urge every Nigerian, especially whoever feel that they're at risk, to know their status today and do something about it.
Absolutely.
And doing something about it today is the most important thing they could do to protect themselves and protect their families.
Absolutely. That's a very key message. Director General of the National Agency for the Control of AIDS, Dr. Gambo Aliyu, thanks for talking to us.
My pleasure.